Welcome to Viewpoints. I'm Heather Isvaron, and with me today is Linda Scott, State of Michigan Bioterrorism Hospital Coordinator. Welcome, Linda.
Thank you, Heather. It's nice to be here.
Today we're going to talk about public health as it relates to Homeland Security. I have a couple questions for you.
My favorite topic.
Can you give me the two most significant issues that you see in public health as it relates to Homeland Security today?
Yes, it's kind of hard to hold it down to two, but let me just tell you two that I think are really of the utmost importance for Homeland Security. Obviously, we're hearing a lot in the news about pandemic influenza, avian influenza. The whole issues associated with pandemic influenza are very complicated, and the role of public health is to protect the health of the public within their jurisdiction. That means a large population. So there's very complex issues when you start looking at isolation and quarantine, the ability to give medications, to care for patients. It's going to be very, very complicated, and we're working on that issue with limited resources. There have been additional funds that have come down from Washington, but there never is enough, and we're really dealing with a shortage of personnel and a shortage of resources. The second thing I think I would talk about as being a significant challenge is that many people lump public health and medical health under the umbrella of public health. But really, when we start talking about things like pandemic influenza and caring for patients, we're really talking about the healthcare system. So it's very important that Homeland Security understand that there's public health and that there's medical health. And the majority of medical health is really private, non-governmental. So that adds another layer of complication to those processes.
And how can other Homeland Security agencies partner with public health on the state and the local level?
Well, I think it comes down to relationships again, and it comes down to really having knowledge of what the issues are. Some of the 7 national priorities are mass prophylaxis and medical surge. Clearly, those are health-related issues. So in order for us to work together from a Homeland Security perspective, we really need to understand what everybody's role is, and then how do we integrate those roles? How do we work together? How do we bring the common issues to the table so that we're not all working on the same issue? We need security. There's a lot of issues that go along with that, and we can't do that alone as public health. So that's where we really need to work more closely with our Homeland Security partners. The other thing, again, that I talked about is that private, non-governmental health professionals are a majority of public health and healthcare. So when we talk about Homeland Security, how do we integrate the private partnerships into these initiatives? How do we elicit volunteers from the private healthcare sector? How do we get those folks as part of the system, as part of the process? If we deploy them, reimbursement, resources. There's really a lot of materials that can come from private to the table with Homeland Security, but it has to go both ways.
And do you have any best practices or any recommendations or an example?
I think we learned a lot from Hurricane Katrina, and we learned a lot about the needs for public health, sheltering over the course of time. So I think a lot of states are working with their private partners, are working with local public health to do some coordinated planning, to do more regionalization so that we are leveraging resources from all of those sectors.
You know, as I'm around the country and going to conferences, I get the feeling from public health officials, both state and local, that they're underappreciated and overworked in terms of Homeland Security responsibilities. So how can public health officials find a seat at the Homeland Security table?
Well, I think that's an excellent question, and one of the things that I think is important for folks to remember is that public health has been around for a real long time. And they're kind of like the Maytag repairman. They do a lot of things behind the scenes, and they have a lot of value, but they don't have a lot of resources. They've been underfunded for many years. There's been more funds going to public health, but there also is a lack of public health personnel. We're having a hard time getting more people into public health. Young people are not seeing public health as an industry that they want to get involved in. Certainly with Homeland Security, that there's more need and people are recognizing the role of epidemiologists and public health nurses. So I think that we need to look at this as a good discipline for folks to get into, a good profession. And also I think public health needs to step up a little bit and really do a lot of education and training on how they can support Homeland Security and some of the Homeland Security initiatives. some of the emergency support functions. Where do they fit in? What good value, medical intelligence and things that they can bring as well.
Lots of things to think about, lots of
Absolutely.
questions.
Absolutely. I think it's a great opportunity.
It is, certainly. Thank you for your time today.
You're welcome. Thank you.